All right, we will talk about cardiovascular system today, pathology of cardiovascular system. Okay, so the first heading is atrial disorders, means the vessels disorders, the vessels in which there is any deformity or any dysfunction. First number is Mockenberg medial calcific sclerosis. Okay, the what are the pathophysiology? Number one, the dystrophic calcification of the muscular arteries in age of older than the age of 50. So most important thing is the age, old age disease, calcification. One point is calcification, another point is 50 years age. Third point, it involves the media. Okay, there is three layers of the vessels. Outer layer is adventitia, middle layer is media, and inner layer is intima. Okay, when the intima is involved, there will be obstruction of the vessel, and there it is, after the intima there is blood. So if there is obstruction or narrowing of any intima, then it will cause the obstruction. If there is obstruction of media, or if there is less occlusion or calcification of media, then it will has no effect on the blood passing in the vessel. Obviously, if there is a large media involvement, then it will push the intima. Ring-like calcification is seen in the media, and the pipes turn appearance. Pipes turn appearance on the X-ray. Example is the radial and ulnar arteries. So it is significant in radial and ulnar arteries. What is the summary of Mockenberg medial calcific sclerosis? It is dystrophic calcification. Second number, it has older people older than 50 years of age. Third, media involvement. Fourth, it will not obstruct the vessel. Fifth, ring-like calcification. Sixth, it has pipes turn appearance on the X-ray. And seventh, the radial and ulnar nerve involvement. Okay, I hope it is clear to you. The second is the atherosclerosis. Okay, you will confuse it with atherosclerosis and atherosclerosis. There is the atherosclerosis. There is difference between atherosclerosis and arteriosclerosis. The arteriosclerosis, the involvement of small arteries and vessels. And in atherosclerosis, the medium-sized vessels are involved. The medium-sized vessels are involved, and they has atheroma plaques. Atheroma plaques are in the atherosclerosis, but in arteriosclerosis, there are two types of arteriosclerosis. How they are hardened. First is haline by the deposition of proteins, or by the deposition of or hyperplasia of the smooth muscles. So what we concluded, that in arteriosclerosis, either the protein deposition or the smooth muscles hyperplasia, but in atherosclerosis there are the plaques of fatty streaks or atheromas or the lipid deposition that will cause the stiffening of the vessels. And the other thing is the intimal thickening. So it will cause obstruction. When the intima is involved, it will cause the obstruction, and the vessel will be thickened and will obstruct the blood flow. When intima is hardened or it will thick, then it will narrow the vessel and causes the less flow of blood. Okay, so in atherosclerosis, the haline is associated with the diabetes mellitus and essential hypertension, and the hyperplastic atherosclerosis is associated with malignant hypertension. Like it is uncontrolled hypertension will lead to hyperplastic arteriosclerosis, that is the involvement of small arteries and arterioles. All right. And there is one more point, that onion-like skin appearance of the arteries, of the small arteries. Okay, the atherosclerosis, it is modifiable. Smoking, hypertension, increased LDL or decreased HDL, decreased physical activity or obesity, like all these are modifiable. Common site are abdominal aorta, coronary artery, popliteal artery, carotid artery. So the mnemonic is a copycat named Willis. first thing is abdominal aorta. First it will deposit in abdominal aorta, then it will involve the coronary artery, then it will involve the popliteal artery, then it will involve the carotid artery and the circle of Willis. What are the complications? It will rupture or cause the hemorrhage or thrombus, or because the vessel is narrow, so there is increased chances of hemorrhage. That it can like rupture, or it has increased chances of thrombus or emboli.